So we already talked about what causes this benign prostate enlargement. Now, if you try to avoid all the factors I mentioned in last video about prostate hyperplasia, and you still have the urination problems, that means your bladder function become weaker. So you cannot void your bladder completely. You always have residual urine there. And what you should do, you can try the acupuncture, because there are articles published in prostate cancer, prostatitis disease in 2015. And Dr. Sahi, he recruited more than 100 patients who have chronic prostatitis. And he did acupuncture treatment comparing to the acupuncture points, which non-acupuncture points. And then they will measure the chronic prostatitis symptom index, which is a score to measure the chronic prostatitis severity. So they did 6 months, 8 months, 16 months, and 24 months after the acupuncture treatment. The acupuncture group comparing to the non-acupuncture group, the urgency of the urination and frequency of urination much better than the score. The chronic prostatitis symptom score is much lower in the acupuncture group. And there is another study published in Chinese Acupuncture Journal, and Dr. Xu comparing acupuncture Maxa group with the Chinese herb group. This herb called 前列康片, and that's has many herbs put together to reduce the inflammation of the prostate. So they recruited 64 people in each group, acupuncture group and herbal group. And they will use international prostate symptom score to measure how the symptoms are improved. So one is the residual urine in the bladder, how it changes after acupuncture, before acupuncture, and also the maximum urine flow rate. And so these two symptoms are improved in both groups. But in the acupuncture and moxibustion group, the effective rate is 89%, and in the herbal groups, it's a 68.7%. So thinking about if you are willing to combine acupuncture, moxa, and herbs, then you can reduce night urination, and also you kind of empty your bladder more. That way you can prevent the weakness of the bladder muscle. So in the future, when you reach 90 years old, you don't have to get up 2-3 times, and you can avoid urinary tract infection. So try the first step, avoid all the factors or reduce the factors and to cause the urination problems. And then if that's not satisfying you, you can come to acupuncturist and herbalist to get treatment. And if you want to have more information about benign prostate hyperplasia, you can go to bostonchinese-acupuncture.org, and I wrote many articles about the clinical cases I treated, how they have improved the symptoms.